Hi, my name is Mark Olives, and today I'd like to talk to you about knee braces. Now there's several different kinds of knee braces and there's a lot of different applications. I'm going to probably primarily focus on just a knee brace you'd utilize for a more simplistic knee injury. They do have knee braces that are available for, say, arthritis that help reposition the knee. There's other knee braces that you would utilize after you've torn an ACL or the ACL ligament in your knee, which is a major supportive structure. But mostly I want to talk about just something you'd have, a slip-on brace, something with the little donut hole in the middle, that kind of brace. Now the reason I want to talk about that kind of brace is they are very beneficial for helping you to get through an injury. But it's not always for the reason people think. Some people think, well, I'm getting external support. Well, if you really think about it, most of those braces, you can flop them around. There's nothing that kind of will hold or support things. Other braces, they might have some metal stays, but again, fundamentally, it's not going to provide structural integrity to that joint. So why do you feel better when you wear a knee brace? There's a primary reason for this. And the reason is, number one, you do keep some greater warmth in the area. When you have a greater warmth to the tissue, it's going to have greater extensibility, so it's not going to be so sensitive. So it's beneficial for helping the tissue to not create those big jolting pains, probably is likely because the tissues will stretch and move a little better. Second, you're going to compress the area with those sleeves that do create a bind on the knee. And what that's going to do is help to push inflammation that might be present or might be being produced in the knee. It's going to push it out of there. And inflammation will cause you a lot of pain. So if you can get rid of that, you can also decrease your pain. And then lastly, what happens is you're increasing awareness to an area. A lot of times you've had, say, a shoulder problem that you say, oh man, my shoulder keeps popping. Here, put your hand right here and feel this. As soon as somebody puts their hand there, it doesn't do it anymore. Well, why is that? Well, it's the same principle that's present when you, say, are going to turn your alarm clock off and your arm's asleep. So your hand's asleep and you're trying to press the button and it just, your finger just bends and wobbles and you can't get it done. Then the sensation returns and you plop it right off and you think, why was that so difficult a second ago? The reason for that is when you move your body, all movement is predicated first on sensory information that's returning to your brain. So right now, everyone's brain is receiving information from their body. And body parts that are more active and or have greater sensation to them are going to dominate what the brain focuses on. So when I'm making my move to the alarm clock and I can't feel anything, there's nothing that tells my brain what position my arm's in or my finger's in, and so it can't make adjustments, and so my finger just flops and bends and doesn't get the job done. The converse is true though. If I can increase sensation to an area, my brain has hypersensitive amounts of information now that it says, oh, I know exactly what position we're in. And so as you go to execute a movement, it really fine-tunes that movement and you perform it with precision and it goes a lot better. So that's kind of what the knee brace is going to do, because when you bend, it's going to move and pull and you'll have a greater sense of that knee now. Well, now your brain says, oh, okay, I know exactly what muscles to contract and I know how to avoid that pain, and I can position this knee in a much better position so that we're going to function better. So what you get is what's called increased proprioceptive awareness, which is simply you're getting more sensory information to your brain, and that helps you to better manipulate something. So don't be afraid to use a knee brace. It's not going to be something you'll get dependent on, and also you can take this information and apply the same concept to a lot of different body parts. I hope this helps you out. Thanks.